what is personalized surgery or personalized orthopedic surgery? It is using a three-dimensional image, whether that's an MRI or a CT scan, to create a three-dimensional plan that your surgeon can use to perform a more precise surgery. Traditional surgery in orthopedic surgery is just two-dimensional. A doctor looks at an X-ray or an image and performs a surgery without any guidance. The 3D printed instruments used help to accomplish a precise, personalized surgery that's perfect for you. The Bullseye Ortho technique generally involves 4 steps: precise removal of bone or tissue with a patient-specific device, followed by confirmation that you've removed enough bone or soft tissue with a second patient-specific device. This second device simultaneously can assist with placing an implant, whether it's an artificial hip or spine implant or other implant, and a final device that can assist with placing an implant and/or confirm that an implant is placed properly after it's been placed. Patient-specific technology is helpful for multiple reasons, including we can properly put in the right-sized implant in every surgery. We can reduce the number of instruments that are needed for every surgery. We can reduce the time that's necessary during a surgery. As an example, in hip replacement, we project that a 10-minute savings per surgery in the United States will save $175 of time to the hospital. We project that the reduced number of instruments and trays will allow a busy orthopedic surgeon to have 1 or 2 additional surgeries in an operative day. We project that hospitals will reduce their risk of a second hip replacement surgery by 2/3 with use of the Bullseye hip technology. And we project that each manufacturer will globally save $40 million annually with the reduced need for instruments by using the Bullseye hip technology. In what other areas might this technology be useful? The issued IP will allow for development of Bullseye products in spine surgery, spinal decompressions, spinal fusions, artificial disc replacements, and deformity corrections. The Bullseye technology will be able to be used in cardiovascular surgery, in heart valve replacements, in aneurysm repairs. It provides a better technology than current in dental implants, where we can improve the positioning of dental implants and their longevity. The Bullseye instruments were initially tested by Dr. Ron Schwarzkopf, who is a professor at NYU Langone. He helped in cadaver testing and in improving the product and developing it. The final product for the hip was validated by Professor Alistair Hart, who is the director of the world's largest failed implant retrieval center, the London Implant Retrieval Center, where he collects hip replacements that have failed from 500 surgeons in 25 countries. Professor Hart used rigorous worst-case scenario testing for the Bullseye instruments. He tested these instruments in horribly deformed Crow 4 hips, in revision hip replacements, Paprosky grade 3 with horrible bone loss. And he evaluated the testing of these instruments performed using sports medicine fellows from Scripps and found in these horrible worst case scenarios that the Bullseye instruments allow for 90% improvement from traditional technique in regards to accuracy and hip replacement. How does the Bullseye technology compare to robotics? It is a cost-favorable and time-favorable solution. Robotics are very expensive. More importantly, it takes more time to perform a robotic surgery. And because of this, very few surgeons are choosing to use robotics. The accuracy and time efficiency of the Bullseye technology make it a favorable option to robotics. What is my education, training, and how have I used this? I received my bachelor's and master's degrees from Stanford University in biological sciences. I was an honors graduate of Case Western Reserve University, where I received my medical degree. I received the best of orthopedic surgery training from world-renowned surgeons affiliated with Harvard and Tufts hospitals. I've taken the training I received in orthopedic surgery to become the #1 surgeon in my hospital as compared to 16 of my peers, relating to being the lowest cost orthopedic surgeon in knee and hip replacement surgery, having the lowest length of stay after a knee or hip replacement surgery over a 3-year period. My patients average a 1.4 hospital day stay compared to the average surgeon whose patients stay 2.8 days. I have the lowest rate of discharge to skilled nursing care, 15%. I have the lowest readmission rate to the hospital after hip or knee replacement, 4% relative to the average of 8.7%. Personalized orthopedic joint replacement began in approximately 2012. In knee replacement, we can take a CT scan or MRI scan, produce a 3D model, create 3D instruments that assist with making a bone cut in the knee, whether that be in the femur or the tibia. These instruments make surgery shorter, reduce the need for instrumentation, and allow for improved accuracy as compared to non-3D planned techniques. Believe it or not, in hip replacement, even the best surgeons in the world do not put in this piece, the acetabular component, correctly 50% of the time. When we try to put this artificial cup in, we try to put it at about a 40-degree angle upwards and about a 15-degree angle forwards. And even the best surgeons in the world miss the mark 50% of the time. The Bullseye instruments and technique solve arguably the biggest problem in hip replacement surgery. The instruments allow for planned removal of bone, confirming proper removal of bone, placement of an implant, and confirming that an implant has been placed properly. The first Bullseye jig allows for placement of a guide pin to a depth for medial bone reaming. A surgeon can use a visible pilot hole, 5 millimeters in diameter, to ream bone in a specific orientation. The device can then confirm that a proper amount of bone has been removed. If you try to put in to the original native hip the second device, it will not seat properly until you have hit the target. And once you've hit the bullseye, you then get immediate feedback as a surgeon that there is 3-point contact after you have reamed enough bone. After reaming partially in the medial direction, bigger reamers are used to remove bone to where the final cup will ultimately rest. The third Bullseye patient-specific device is a 2-part device that models all of the bone to be removed during a hip replacement. This third jig, if you try to place it into the partially reamed acetabulum, will not fit. Once you have reamed properly, the third patient-specific device seats perfectly, making 3-point contact. A surgeon then has the option of placing a guide pin through the device, removing the device, and using a cannulated impactor to hit the acetabular component in to the pelvis. This cannulated impactor can then be used to place the implant into an appropriate position. The Bullseye instruments were developed with the assistance of Dr. Ron Schwarzkopf and Professor Alistair Hart. These have been validated to place the implant properly 90% more accurately than with current techniques. The final Bullseye device rests and makes contact with the acetabular component and with the patient's bone when it is in an appropriate position. Again, the Bullseye patient-specific devices are used to assist with removal of bone, confirm that proper bone has been removed, assist with placement of an implant, and confirm that an implant has been placed properly. The Bullseye orthopedic devices will next be used in spine surgery to assist with decompressing bone, precise decompression of the bone, confirmation that the bone has been properly decompressed, to assist with placement of implants, whether that's disc replacement implants or plate and screws or fusion cages. And they also will be used with corrective deformity procedures in the spine. Thank you.